Hello. There are many psychological career alternatives to take. Today we have two experts from our community speak on child abuse. Child abuse is a societal issue, with the U.S. having one of the highest incident rates. It can be seen in the forms of physical, emotional, or sexual abuse, or even neglect. The Child Abuse and Prevention Treatment Act define it as any recent act or failure to act on the part of a parent or caretaker, which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm. It's usually done by someone the child knows and can result in long-term emotional, physical, and mental effects for the individual. The issues and controversies around it are it's hard to intervene and prevent it until after it happens. Not all children have visible symptoms, and there are no current methods to determine who are at high risk. We want to look at today, does being abused as a child lead to abusing children as an adult? And does child abuse negatively impact adult functioning? Our first expert is Ann Kane, who has her Master of Social Work. She has 10 years experience conducting investigations of alleged maltreatment. She has a lot of knowledge and experience working with Child Protective Services and other agencies. And she develops care and case plans to meet the needs and ensure the safety and stability of her clients, mostly children. Our second expert is Dr. Jason Small, who is a clinical psychologist. He's board certified in clinical child psychology and adult psychology through the American Board of Professional Psychologists. He has over 20 years experience as a licensed independent practitioner working specifically with abused children. And he provides psychotherapy in terms of cognitive behavioral, client-centered, and play therapy. Ann believes that child abuse provides us with great information when we have research on it, but most of it focuses on issues after the fact. She wants prevention to be done at the front end, and that's how we have intervention. We know that child abuse results in long-term problems, including mental disorders, physical issues, and substance abuse, and it also perpetuates additional abuse. A study done with individuals shows that histories of childhood abuse and/or neglect are almost 3 times more likely to perpetuate child abuse, which is consistent with other research findings. Child abuse reporting is an ethical dilemma between breaching confidentiality of clients and breaking the law. There are complex interactions among several factors, including diverse professional contexts, legal requirements, professional ethical standards, and the circumstances of suspected abuse. The first concern should be protecting the child. We need more research on how to identify the signs of preventing child abuse and intervene earlier, so removing some of the legal barriers. One of the big methodological issues is confidentiality of participants, since data being subpoenaed in court has increased drastically over the last several years. A great association to look at is the National Association of Social Workers. Dr. Jason Small says research has given us the opportunity to understand child abuse impacts adult functioning. Another study done showed child abuse is linked to various problems in adulthood, which includes mental health disorders, substance abuse, and poor physical health. Statistics reported by Safe Horizon regarding child abuse say 25% are more likely to experience teen pregnancy, 80% of adults meet criteria for at least one psychiatric disorder, 59% are more likely to be arrested as a juvenile, 30% are more likely to commit violent crimes, and 60% are more likely to abuse drugs and alcohol. Most have physical issues due to poor health, high blood pressure, and ulcers. Without early intervention, the long-term impacts can last a lifetime. By better understanding the relationship between childhood abuse and behavior, it's possible to help the victims live a healthy, constructive life filled with satisfaction, love, and trusting relationships. One of the methodological issues is, with research, the negative stigma of child abuse creates people that don't want to identify themselves as survivors and participate in the research studies. A great website is Adults Surviving Child Abuse. Both Ann and Jason believe that child abuse results in long-term mental disorders, physical issues, and substance abuse. Ann really focused on the fact that abuse perpetuates abuse. There are ethical dilemmas with research, as well as people having research done on them, and prevention is the best thing. Jason believes the statistical proof shows we need more done around child abuse. Early intervention is the best help for these individuals, and the relationships understanding we've gotten from research has been a big win. Thank you.